Thank you, Dr. Kaiser, for the introduction, for leading this workshop, and for your decades of service to American veterans. I'd also like to thank Dr. Kirsch as well for the invitation to speak today and for making this event possible. She has incredible knowledge of this field, and it's a privilege to work with her. I never like to be the person right before break, because that means everybody's thinking about that break, but I promise my comments will be brief. I'm humbled to be here at the National Academy to share Cerner's perspective on scheduling and be surrounded by so many brilliant people in the room that really have the knowledge to help define the system in terms of the needs of the VA. We are honored to serve our veterans. Many Cerner associates are veterans themselves, come from military families like me, or have friends who have served. We are honored to implement Cerner solutions across the largest integrated health system in the world, and it's not just software. The Electronic Health Record Modernization Program is a catalyst for transforming and standardizing care VA-wide. That's why we're running a unique clinician-driven national and local process involving hundreds of VA caregivers and staff making hundreds of decisions needed to create one unified configuration across the entire veterans health system. As we're doing that, we're always working on the next. IT is a relatively young industry, and health IT is even younger. It's up to all of us to help define what that looks like. So we appreciate your engagement at this in-depth workshop. Scheduling is a particularly important part of health IT because patient access is the front door. For veterans, scheduling an appointment and checking in are highly visible. Usually they're first steps to receiving care. Clinicians depend on the system to make the best use of their and the veteran's time. And the Yelp reviews of pretty much every doctor's office talk about it. Scheduling is a fundamental capability of any health IT system and a key part of the veteran's experience. We have to get it right. As you all prepare to dive into what a great patient scheduling system looks like, let me share some of the features we're working to deliver to the VA. Our system is resource-based. It coordinates all the key resources such as the clinician's time, types of appointments, and rooms available. With one domain instance spanning all of the VA and the DoD, the system can show the availability of a specialist in another VISN, even a DoD facility, just as easily as it can for local providers. Portal and kiosk integration provide a seamless, easy experience from when the veteran gets on their phone or their computer to schedule an appointment to the time that they show up for that visit. Integration with our full EHR and population health platform will allow VA to see the whole picture of throughput. This will help the organization get more efficient at providing and tracking care, from initial appointments to follow-ups to management of chronic conditions to tracking and influencing access to care standards. And FHIR API integration means that the new system is open and interoperable. Cerner and the VA are developing great tools, but we want veterans to benefit from fantastic work of app developers and people like you who may create functionality we haven't even thought of yet. With the volumes of appointments being scheduled in the VA, the impacts of saving even a few seconds on each transaction is huge. The level of detail you're able to discuss at a multi-day forum like this one is very helpful as the program evolves. We need the input from VA to be able to define the system as it needs to evolve for care for our veterans. We appreciate the opportunity to be involved as well, as we seek to conceive and deliver the best possible experience for each veteran patient through EHRM. With Cerner powering the new military and VA EHRs, we are uniquely positioned to provide a comprehensive healthcare experience for all veterans, including service members transitioning to veteran status. This is personal for me. I would not be here if not for VA care. As a young man, my dad developed testicular cancer. Because he was service-connected through the Air Force, because he had VA care, he survived and thrived. He and my mom were able to start a family, and Dad lived to 64. Every appointment we schedule, every instance of care it supports, is important to that veteran, to their family, and to the next generation. So we appreciate you devoting your time and energy to the important topic. My Cerner colleagues are here in force. I ask that you engage with them throughout the week, understand the systems that we're bringing to bear, and provide them the input of what the VA truly needs. We look forward to seeing the great ideas that you all put together. Thank you.